Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neil Howe and Craig Williams.
Welcome to another edition of Business Authority Radio. My name is Craig Williams, and I have a very unique opportunity to introduce Dr. Nicole Williams. No relation, as we know so far, right? Better known as Dr. K. She's the founder and doctor of chiropractic care at VivaCare Chiropractic and Wellness Center. She's a functional wellness and medicine specialist. I probably need to do that over, but we're not because I'm human, right? So anyways, Dr. K, tell me a little bit about how you got into this practice and what drives you.
So when I was a child, I was a competitive gymnast, and I suffered with something called Osgood-Schlatters Disease, which is where, it happens in kids that are really overactive, too much activity. So I was doing competitive gymnastics and playing soccer, and the muscle develops faster than the bone can keep up. So it's almost like the muscle is kind of ripping the bone off. So they call it a disease, but really it's something that's treatable. But I had gone to my family doctor, and my parents took me. I was 11 at the time, and, they said, take her out of sports. She can't play anymore. She just needs to rest. And so my parents said, well, we're not going to take her out of something that she loves. So they took me to a sports chiropractor at that age, and I was able to keep playing, keep competing. So, and, the other side of it is that I grew up in a very holistic, wellness-based home. So from a very young age, we weren't running to get cough, cold, and flu medicine. It was my mom making some sort of tea or some sort of herbal medicine and kind of giving me that. So I knew I wanted to be in healthcare, and then I did my undergrad in kinesiology. Took a year off. My mom, unfortunately, she passed away during that time, but I took a year off and volunteered with a sports chiropractor, and I volunteered with my family physician. And I just felt like I could make more of a difference as far as healing people and getting them better without the use of drugs or surgery. So, that really excites me. It's what I'm passionate about.
I think that's incredible. I mean, I just recently talked with a chiropractor who focuses on children and mothers. And that was the first time I'd heard of because you think of children, they're constantly developing, and usually we correlate chiropractic care with a car accident or, a fall or something like that, and when you're much older. And it was very interesting to hear that perspective of introducing chiropractic care to younger individuals. And I see how it's impacted your life a great deal, because obviously your parents were wise enough and loved you enough to not keep you away from something that you loved, but also were knowledgeable of other alternatives than taking you away from that. And I think that's awesome. So you didn't pretty much grow up around these parts here. So, I mean,
I did not.
So you're
my family calls me Dora the Explorer.
Oh, okay.
So I grew up in, a town outside of Toronto, and then went to school in Toronto, and that's where I practiced for 5 years before moving to the United States, and then ended up in New York City. Had some friends and family there, so I was like, let's try something new, and went to New York. Was kind of a stepping stone, and then I knew I wanted to have my own practice, kind of like my dream practice, which is where I am now. So New York, once I kind of looked into it, the expense was just ridiculous in order to be in a nice area. I just knew I wasn't going to be able to pay my rent and bills and still have a life outside of that, because it's crazy there. But I came to Atlanta 14 times before moving here. Wow. Within an 18-month period. Scoped out different areas because I didn't really know a whole lot about Atlanta, and did a lot of market research and finally chose this space. So I do have some family here, and can't beat the weather coming from Toronto. I mean, definitely don't miss winter.
It's an extreme. We have somewhat of a balance here, and we do have our extreme days. But outside of that, tell me about the name of VivaCare.
So VivaCare, my clinic's named after my mom. Her name was Vivine. So my mom, she was a passionate health advocate. Like I said, we grew up in a very holistic, wellness-based lifestyle. Never really got sick. My mom, she cooked home-cooked meals every day. You had a headache, she was going to make you some ginger tea. It wasn't giving you Advil or Tylenol or anything like that. And she passed away in 2002 from lymphoma, which is a cancer that at the time, they just didn't really have great treatment for it. Basically, if you were diagnosed, they said you die within 2 years. So she actually had it 10 years prior to that and did a lot of, holistic type treatments. And she went into remission for 10 years. So we were really blessed to have her for that period of time. But I had always said that, I was going to open up my dream practice. So I named it after her. And that's where
beautiful.
VivaCare comes from.
That's beautiful. It feels that I feel the energy. I like there's when you come in, there's a sense of movement and how it flows going to the back. You have your treadmill. I think that was the first time I've seen a treadmill in a chiropractic office. But I see the power in that, either encouraging or also observing your clients and their posture. And I'm sure you're looking at me right now, but their posture, and it's the functional part. I know it has a lot to do with a lot of our ancillary issues that we have. People think just back pain. No, I mean, it's central to the whole body. And so tell me a little bit more about the functional part of your practice.
So when someone comes in, and this is maybe where I practice a little bit different, I was trained in Canada, and in Canada you're trained to do the physical therapy and chiropractic component together. Yes. So if somebody comes in with back pain, I don't just look at them as a back. We're going to sit down, we're going to talk about your nutrition, we're going to talk about what you're eating, your lifestyle, are you getting any exercise in? The equipment that you saw out in the gym area we have different programs for weight loss, wellness, nutrition is going to be a part of everyone that comes in. We're going to talk about it because, say, for example, someone's got back pain and they're, 20, 30 pounds overweight and the weight is concentrated around the stomach. Mm-hmm. Well, I could adjust you all day and tell you to come see me every day. And you might feel a little bit better, but it's not going to help you take care of yourself.
Yeah, and you said holistic, and one of the themes that I see around here is your health above all else. Mm-hmm. So, I mean, holistic means that. And I did see up front there was information on just about every aspect of an individual's life, the skincare. Mm-hmm. I mean, and, your body, the skin being the biggest organ of our body, and it covers that part that you concentrate on. Tell me what else is expected, or some of the barriers people have when they come in and then they see that, hey, I just want to get an adjustment. How do you deal with that?
Yeah, so
you did just mention that, you're looking at it from a holistic perspective, but how do you shift that mindset?
The mindset, yeah, absolutely. So I tell the patient when they come in, look, you are an entire person. There are multiple factors. You got kids at home, you got a job, 2 jobs, you got a dog you got to walk, you got high stress at work. All of those components play a factor in how our body heals. So I'm going to ask you about those things. And maybe your back hurts because you've got a lot of inflammation in your diet. So in order for me to treat you as a whole person the best that I can, we need to address those other factors. Because my goal is not to make you dependent on me, right? My goal is to help you be the best version of yourself.
That's awesome. As you were saying that, I saw how we tend to, it's our nature, at least here in the States, to compartmentalize everything as, this aisle or this particular product, and we kind of separate ourselves from our back. Mm-hmm. And it's easy to do because it's behind us.
Right.
So we take it for granted.
Yeah.
And in that sense, it's kind of, it sounds like you're able to remind us that we're a whole person. And the extremities are, they're different parts, but they're a part of one body. And I could see how it's easy for people who don't grow up in that environment of a holistic, when you have great parents who brought you up and planted that seed in you, and especially when it comes to chiropractic care, because we usually go to chiropractors when it's, after there's been some issues for a long time, as opposed to using it as, part of a treatment or part of a lifestyle.
Right. Yeah, prevention. So, a great analogy that I give to people is, if you never rotated the tires on your car, you never changed the oil, it's going to stop working. It's going to progressively deteriorate. Yeah. So what are you doing to take care of your body that you put miles on in a year? Mm-hmm. So, if you just focus on preventative maintenance, giving your body a monthly tune-up, you're going to age much better. A study was done at the University of Texas that showed your mobility peaks at the age of 23 years old. So that's, your mobility peaks there.
Peaks at 20.
At 23.
30 years ago. Wow.
And if by the time you hit 50, you lost 50% of that mobility you had at 23.
Serious? I wouldn't know that. Somebody didn't. I hadn't.
Nobody told you, right?
Now. Yeah.
Now, with the study, if you include chiropractic care from that peak at 23, the decline is much less, such that by the age of 90, 100 years old, you're looking at that 50%.
Okay, now you're making me feel okay.
So go to your chiropractor.
Well, I do, and it's a practice. It's part of and I don't run as much as I used to. Mm-hmm. I'm not pounding, but as far as any getting up. Constantly, getting up out of a chair, out of the car, just moving the body, sometimes bumping into something and throw you off a little. Don't deal with too many falls. I can't remember, knock on wood, that helps. But that's interesting. That's the first time I've heard that. And I feel I'm getting better. And maybe that's all in my head. But from what you're saying, I guess those early chiropractic visits, because I think I started chiropractic care when I was about 19 or 20.
Oh, wow. That's great.
Yeah. And I'd say in the last 6 or 7 years, it's been a part of lifestyle as far as treatment, not to, the preventive part that you're talking about. Tell me a little bit about what you see on the horizon now that, we just last week celebrated 122 years of chiropractic care serving humanity. Mm-hmm. You've been at it for,
10 years.
Not that much, but almost 10% of that.
Yeah.
You've contributed to that. What do you see on the horizon for chiropractic care outside of everybody's awareness and everybody, because of the healthcare, noise out there, mm-hmm. people are looking for alternative ways to take care of themselves.
Yeah, I definitely see right now. So if you look at the statistics, it says about 8 to 9% of the population sees a chiropractor, which is ridiculous if you think about it.
It is.
Yeah, and I think it's just due to a lack of awareness. As with any profession, there's going to be good and bad. You're going to have your good dentist, your bad dentist, mm-hmm. your good medical doctor, your bad medical doctor. So, people sometimes get these notions in their head. Oh, if I go to the chiropractor, I have to keep going forever. Well, do you want to keep using your body forever is what I would say to someone.
Yeah.
So I think now, especially as healthcare and the times are changing, is that you're getting more people become aware of, okay, well, what can I do not to end up in the hospital or a nursing home, when I get older. That same study, it showed that people are living longer. Mm-hmm. So by the year 2030, the average lifespan is going to be 90 years old. So at the age of 90, do you want to be immobile and bedridden, or do you want to be active, alive, and vibrant, right?
Yes, definitely.
Yeah. So, I think chiropractic care is going to gain more popularity and use in the community. That would be my hope and prayer, where people become more conscious of living better.
What are you doing in the community to make sure they see more of you outside of the
outside of the office walls? Yeah. So we do a lot of events. We do corporate lunch and learns. We get out into the community. We do, 5K races. We do things like the Sandy Springs Festival, just to kind of raise as much awareness as we can. Also in the office weekly, we do hold a wellness class once a week, where we invite members of the community just to educate people on different topics. So one week it might be on diabetes, one week it might be on back pain, and just educating people on how little things that they can do on their own to have a healthier lifestyle.
Awesome. I'd like to hear why you think chiropractic care and physical therapy should work more hand in hand. Because I for some reason, I thought that physical therapists were chiropractors.
Okay.
So is that not true?
Yeah.
All physical therapists aren't chiropractors.
No physical therapist is a chiropractor necessarily,
Gotcha.
right? It's two different types of training. So,
Gotcha.
The way I was trained, physical therapy was integrated into our training.
Gotcha.
I'm not quite sure how it works here, but my understanding is that it's a little bit different. So, but basically physical therapy, if you think about it, it's exercise and rehabilitation, right? Chiropractic, if you just put it down to the basics, it's alignment of the spine, stimulation of your nervous system and your muscle system. So the two really do go hand in hand, because if you have someone come in and their back muscles are weak, okay,
It's going to affect their other extremities. So that's my question. I kind of, ask it a little different, but it seems like, why aren't the two the same? Because chiropractic care starts with the back, which is central, or the foundation, and it's going to affect any other part of your body.
Right. I don't know why they're, so separate. I guess more so on the physical therapy side, like I said, it's going to be more rehabilitation, strengthening of muscles and those sorts of things. On the chiropractic side, you need to have your nervous system functioning properly in order for that physical therapy system to work.
To be optimized.
Yeah.
Okay, so I'm in my head with this, but I'm going somewhere. And I think the place is with chiropractic care, you're usually, an adjustment is somewhat of a rehabilitation or corrective, to the functioning of the whole body in essence. So when we get into physical therapy and they're focusing on maybe one area to get that back mobile, isn't the condition of the back, just as important in the healing and maximizing the movement of that other part, whatever it is. Yeah,
absolutely. Because when you get adjusted, it increases the nerve signals from the spine. So if somebody's got a foot injury, say, and, the nerves that go to the foot come from the back. So why not go back to the foundation and treat that as well? It can be treated concurrently. Yeah. But it's definitely a missing link, I think, in some places that needs to be.
I think we're onto something. And you provoked that. I'm sorry it kind of came out like that, but you gave me that thought, because I was thinking about your introduction to it at a younger age and how that affects the promotion of that to younger people. Do you have younger patients?
Yes, I have a few young athletes. The youngest would be 8 years old. Wow. She's actually coincidentally a gymnast and a soccer player.
Wow.
So it's a lot of fun treating her. And, she loves it when she comes in. She can come in and she can tell. She's like, oh, I just don't feel right. I can't jump as high. And, at the young age of 8, she notices a difference.
Her consciousness is, she has a consciousness for that. And I think that, like we talked about the mindset piece, the change of even the tools, most people associate chiropractic care to a noise like your knuckles being cracked or something like that.
Right.
And there's a lot more technology, a lot more methods that have come out to, and it doesn't always start with cracking your back.
Exactly. Yeah. And, people say, oh, I was cracking my bones and those sorts of things. And that's not what the noise is. The noise is just air pressure basically being released. So when you have pressure build up in anything, eventually, if you build up enough pressure in something, it's going to explode. It's going to fall apart, right? So, why would you want to carry all that extra pressure inside of you, right?
Do you have children?
I don't.
Okay. I could see you as an incredible mother, and I would wonder how soon you would start chiropractic care with your own children.
Right away. I when I was living in Canada, I would do some assisted deliveries. So you can actually labor naturally, and I do have a few doctors in the area who send me their patients who are pregnant. Right? Because when you're pregnant, you can't have, you're not supposed to have Advil, Tylenol, and those sorts of things. So they come to me for pain management. And the adjustments really help to keep the mom feeling good, but also make the delivery process easier. So then baby comes out, and, my youngest patient was 2 hours old. And
wow.
Imagine being squished up in a tiny space for 9 months, and then coming out of a tiny, tiny little space and being squished even more. Just getting that first adjustment, as soon as possible really helps to stimulate the nervous system. Also with breastfeeding too. Some mothers have a hard time breastfeeding, but it's actually because the baby can't turn their head because something got locked up, or
when they were inside,
or even coming out, like maybe forceps were used and damaged their neck. So the sooner the better, and then especially toddlers, they fall, I think it's what they say, like 1,000 times in a week when they're learning to walk, something crazy like that. So why not just keep them functioning optimally and develop, as best they can.
Wow. You mentioned classes that you have here. Are there classes are you the only doctor here that instructs, or do you bring others in to teach certain other wellness classes?
Topics? Right now, I do the majority of it. We will have a few guest speakers come in sometimes, but we're always looking for, other doctors, experts in different areas to come in and educate, our patients and patients within the community.
Gotcha. So it starts and ends with a conversation. I would say it sounds like you have people come in and you listen. You get them to the table or the treadmill, and then there's another conversation. How important is that conversation, and how often do we need to hear that conversation about wellness and functional help that you offer?
Yeah, so any of my patients that are here, it's ongoing. I mean, every time they're in here, and I don't just throw a ton of information at people because, not everybody's receptive or open to it, but I'll plant little seeds. And then, throughout the course of your treatment, I'll be like, hey, did you give up soda yet? Did you know that sugar is causing inflammation in your body? And it may not happen on the first visit, it may not happen the week after that, but inevitably it always ends up happening. Or, maybe your knees wouldn't ache so much if you lost 20 pounds, So let's take a look at what you're eating. And, sometimes people want to break it down to dollars. So I'll say, okay, do you want to save money on your healthcare? Look at the cost of healthcare and how high that's going up. We don't even know if we're going to have that, access to certain resources in the next couple of years. Yeah. So what can you do for yourself now to make sure that you're in a good state?
So you coach them to be responsible for their own bodies, and I think that's
exactly
beautiful. How do people get in touch with you? Where do they find you? What's the best way? How would you rather the audience find more?
So our website is vivicarewellness.com, VIVICARE. Wellness.com. You can reach us there. There's a form there where you can fill out an inquiry, and we'll be happy to give you a call, or you could call the office at 404-963-1913.
Tell me what you would tell a 20-year younger Miss Williams. That makes you about maybe 13 or something like that.
Not quite, but thank you. What would I tell myself? Dream big, dream bigger. I always said it was my dream to have my own practice. And I thought, and do things kind of the way I wanted to do things. And now that I'm here, it's like, maybe my dream wasn't big enough because I got it already. So on to the next one. At one point I had thought about, franchising kind of the model of care. So that's something that's potentially on the horizon. And also figuring out a way to reach a larger scope of people. So, I've got my first overseas client that we're doing some health coaching with, actually in Jamaica. And
great destination.
Yeah. So it's a lot of fun expanding my reach and, dream bigger, because once you set a goal and work towards it, you can achieve anything.
Well, tell me a little bit about that. So there's a virtual practice, I see. Is that?
No, so it's I do the consulting over the phone.
Okay.
Yeah, more lifestyle type stuff. There's a chiropractor that I know there who does more of, just the adjusting and that sort of thing. But my kind of niche, I guess, where people kind of know me for is being able to put the pieces of the puzzle together. So if you look at the human body kind of as a puzzle, right? And connecting all those things, then it becomes easier to treat rather than just looking at the one piece.
Yes, I see it now. You talked about the model of care, which, you know, as soon as you said that, a light came on. Mm-hmm. Even the layout. The treadmill is as soon as you come in, it's kind of like where the feet, and then you have the adjustment table. Is that adjustment table?
So we do muscle stimulation, DP. We actually have oxygen therapy with the treadmill.
Yes,
so
I saw that.
If your excuse is that you're too overweight, you can't breathe when you walk, well, let's give you some oxygen then and fix that. Let's take that excuse away.
Yes.
Yeah.
I think that's awesome.
You know, we do vibration therapy. The adjusting rooms we have is private rooms that are off to the left side. If somebody's got, you know, some confidential questions or those sorts of things that they don't want to discuss in front of other people, we do use those rooms as an option.
It's very open too.
Yeah.
It allows a lot of flow here.
Yeah, well, thank you. That was intentional. We try
to
keep the, you know, positive energy and a calm, peaceful place, because I mean, people have so much stress in their lives, and you know, right down to the low jazz that we play. Certain types of music are actually proven to lower blood pressure. So, you know, most of our patients, when they come and they're like, oh, okay, I can just relax and breathe, I'm here.
You have great energy.
So, yeah.
Dr. Nicole K. Williams. Dr. K. Thank you so much.
Yeah, thank you. It's been a pleasure. Thank you.
You've been listening to Business Authority Radio with Neil Howe and Craig Williams. To learn more about the resources mentioned in today's show or to listen to past episodes, visit businessauthorityradio.com.